All right, good evening, everyone. Welcome to CHAMP. My name is Dr. Barbara Davenport, and I will be your presenter this evening. And I also want to announce that I am the coordinator for the Community Health and Medical Professions Center. Again, thank you, and hoping that when you leave here, you'll leave with a lot of plethora of information and one that'll help you make a decision to walk into CHAMP 2425. I'm going to give you a brief background. Also, we're going to talk about the program and pathways overview, course sequence, and application process. Here you'll see a yellow light bulb. Whenever you see a yellow light bulb on the slides, just keep in mind that the information on that slide you may want to remember because I may ask some questions at the end of the presentation, okay? Just wait there, come take a seat. As a nurse, we have the opportunity to heal the mind, soul, heart, and the body of our patients. They may forget your name, but they will never forget how you made them feel. Maya Angelou. This quote I can connect to what it reminds me of my own experience as a patient. And I want to share that experience with you now. As a new mom, having my first child, I was in the hospital. And one of the things that I do remember from that experience is knowing that I was cared for, how I was cared for, as well as being attended to. And I felt as if the nurse, I was her only patient. In that same, she made me feel like I was a priority. And in the back of my mind, I was saying, how can I take her home with me to help me further care for me and my child? So those are the experiences that I agree and that I have in my experience that the medical profession leaves you with. So with that, I want to pose all of these students in here, and I want to ask you, what qualities do you think that a medical profession should possess? Anyone, any volunteers? What quality do you think that a medical profession should have? Yes. Kindness. Kindness, absolutely. They should be kind. What else? Yes. Empathy. Good. Empathy. I think that's very important. Absolutely. One more. Yes. Integrity. Oh, that is huge. Integrity is very, very important because you want to make sure that your morals and your values are demonstrated in your practice and in your behavior. Is there one more? All right, great. But those are some very good examples, and those are some very important traits that you should possess as you are in the medical field. Now, this presentation will also cover 2 career clusters. I want to talk about what is a career cluster. A career cluster is a group of occupations that have similar features, okay? And in this, CHAMP will offer career clusters on the human services as well as health science. Within those clusters, we will be offering 4 unique pathways. And within those pathways, we'll actually generate multiple careers, okay? And those pathways are 3 new pathways: mental health. We also have 2 nursing pathways, an LPN, licensed practical nurse prep, as well as a Bachelor's of Science prep. And then we also have biomedical, that's a different session. But tonight, in this session, I will be covering mental health and the 2 pathways within nursing. Now, in this here, you will see the same thing in your pamphlet on page 9. This is mental health services. What I'm showing you here are all the courses that are prescribed by grade level. Okay, and these are the courses that you'll be taking as a rising 9th grader, also as you go through to your senior year. I want to bring to your attention within this pathway, there are some courses that are outlined by a red box. These are the required courses that you would take within the pathway of mental health, all right? The first course as a rising 9th grader is what we call Intro to Health and Medical Science. It is a 1-credit course, and these are some of the topics that you will explore and gain more understanding of: anatomy, physiology, pathologies, therapeutic interventions, all those cool things that you will actually be practicing once you walk into the medical field. And there's a light bulb. Mental health assistant careers. Now jump to your senior year because I think this is a very cool, exciting course. In this course, you're going to dive even deeper into careers that would allow you to assist in mental health. And some of those careers will psychiatric nurse practitioners, psychologists, clinical mental health counselors, as well as clinical social workers. So this course will set you up and prepare you for different careers within mental health. Now, I want to also highlight within this pathway, you will have dual enrollment courses. So the cool thing about that is you can earn college credits while still in high school. Okay, and those courses are dual enrollment medical terminology, as well as dual enrollment psychology. Moving right along to licensed practical nursing. Here again, you can find this information within your pamphlet on page 7 or 8. And here it does outline the different courses that you will be taking throughout your the 4 years. Now, within the required pathway, these courses very similar to mental health, the first course, which is in rising 9th graders, but then when you move to 10th grade, you have what we call health assistant careers. And then that's also in 11th and 12th, which I'll explain further along, is when you're taking your Nurse Aid 1 and Nurse Aid 2, where you'll be required to have clinical hours. Now, health assistant careers in grade 10, here again, is 1 credit. And now you're exploring more about what type of careers in the healthcare field that you're interested in, all right? You'll learn more about the body structure and its function, the principles of heart and disease interventions, and other information that regards to health and patient care systems. Now, the nurse aid, you will take this once you're in 11th grade. If you notice, this is 2 credits. And I also want to bring to your attention that the nurse aid program is governed by the Virginia Department of Health Professions Board of Nursing. And what that means is this course is taught by licensed nurses, as well as they have to follow a strict guideline because it is governed by the Virginia Department of Health Professions. And the curriculum is also provided by Board of Nursing. All right. So here in 11th grade, you study growth and development across the lifespan, measure and record vital signs. You're getting more in depth within that nurse aid pathway. Now, once you get to your senior year, it gets much more intense, even more exciting. But this is the opportunity where you actually have to do clinicals. You're actually going to a facility, and you have to meet the 140 clock hours of clinical experience. 40 of those hours will be with direct client meaning that patients who will need medical services. And then you have 20 hours that are geared towards lab, okay? And also, in order to sit for the exam, you must pass Nurse 1 as well as Nurse 2, meet your 140 clock hours, take the exam and pass, and then you actually can graduate the CNA, okay? Which will allow you to walk right into the workforce as an entry-level CNA, Certified Nursing Assistant. The Bachelor of Science in Nursing, this is, again, a prep program that prepares you for an interest that you want to pursue, maybe towards a 4-year institution, okay? Now, within this pathway, you will notice there are more dual enrollment courses, which is great because here again, you have the opportunity to earn college credits within, as well as being a high school student, all right? So if you notice over the 12th grade, you have different options for your different maths. In 11th grade, you have options in your, here again, in your math courses as well. Now at the bottom here, you do see similar courses where you've taken freshman and your sophomore year. As well, you'll take dual enrollment medical terminology and dual enrollment psychology. So this here is filled with a lot of dual enrollment courses that will give you that experience and also prepare you and set you up in order to be college ready, okay? Now, you may ask yourself, what's in it for me? So after high school, here again, you have 3 options. Once you have completed Nurse Aid 1, Nurse Aid 2, and completed those 140 clock hours, you pass your exam, you may walk into a workforce and actually work as a certified nurse assistant. And those are typically in your nursing homes, your residential care, or your rehabilitation centers. Or you may decide to further your study at a community college, take those dual enrollment courses. Also, the Nurse Aid 2, keep in mind, that is an introductory course that will lead to the LPN. So you can take that, those courses and your exam, passing it, and go into a community college and transfer into their practical nursing program. Those who want to go further into the Bachelor of Science Nursing, you can actually go into that pathway with the prep that we've already prepared you for and enroll into a 4-year institution. And that's where you will actually graduate with your registered nursing. Okay? The CTSO organization that is associated with the courses within this pathway is called HOSA, all right? And this is a great opportunity for students to be a part of. Here you gain leadership skills. You learn how to actually communicate. You have effective communication skills. You have an opportunity to compete at the state level amongst other schools within the state of Virginia, as well as national level. And those competitions allow you to actually enhance your skills. It also sharpens your skills when it comes to healthcare. And the cool thing about the competitions that they are actually filled with 100% healthcare folks from the industry that will panel you, that will also, you can ask questions, and you shine in front of those, and also you can see the actual work in person. Also, integrated curriculum. In those courses, you have an opportunity to have hands-on and also apply what you learn in the classroom within the field. So that curriculum is actually integrated, and it also gives you an opportunity to relate to real-world scenarios. It's also on work-based learning experiences, internships, externships, all right? Transportation, as you heard in the overview. All current high school students beginning a program in one of the centers, you will transfer to that offering school. If you're already enrolled in the travel program, you will continue to travel to those offering school locations. Application process, which is already open. It closes January 5th, and you will be notified on February 5th should you be accepted. And if you have any questions about what you just heard tonight or anything about the application process, transportation, you may email academicprograms@staffordschools.net or go to our website, Secondary Offerings and FAQS. Okay. Now, as I mentioned before, any slide that had the light bulb. Now, I have 3 questions. First question, how many options are available post-graduation? How many? Yes. 3. What were you going to say? 3. Good. That means you guys were listening. Awesome. Next question. What is the name? Oh, I'm sorry. What is the name of the student organization associated with CHAMP? Yes. HOSA. Very good. Very good. Last question. How many career pathways are available at CHAMP? How many pathways? Yes. 4. We're going to go a little further. Who want to take a crack at a name? What is the name of one of the pathways that we just talked about? Anybody?
Like the LPN and the
Yeah, but you're not a student. Okay. That's okay. That's okay. But
I think they got confused.
that's okay. Thank you. Thank you. So at this point, I'm going to open the floor up to any questions. Does anybody have any questions about CHAMP? Yes.
Could you kind of give an example of what it would look for? Say you go into the nursing with the bachelor's.
Mm-hmm.
Typically, it's like 5 or 6 years, depending on how long it would take you out of college. This is going to shorten it to just the 4 years, or possibly 2.5.
Well, I would say if you notice within the pathway, I'm going to go back to the
I see a
pathway.
lot of dual enrollment, so I know it would be based on that, but I also see a lot of language. That's all going to be transferred over college?
It depends on the college to which your child will be enrolled into.
Okay.
And some colleges will accept these courses, some may not. So based on how many courses they will accept will determine how many, what role they will in.
Do you guys know what colleges are going to be accepting some of these programs?
If you're staying in the state of Virginia, Virginia will most likely accept most of your dual enrollment.
And here's our dual enrollment.
Yes, there's our dual enrollment person. Amy.
Well, I see.
Thanks, Amy.
And I know this is a sample, but I'm just trying to get an idea of what that looks like for my daughter to, go in so that she has a good idea of how long it's going to take her.
So she can also take any student can take additional dual enrollment classes that we offer, and that will get them even further toward a degree,
Okay.
whether it's that associate's degree or that bachelor's degree.
Yeah.
The DE medical terminology may or may not transfer into the program. It really depends. If you're going into that LPN program or an associate's degree program at Germanna, that's their course, so that's going to transfer really well.
Okay.
The DE psychology is going to transfer all over the country, and that is your intro to psych course, and it's probably a requirement in every single degree, no matter healthcare or not. And then we also offer English 11 and English 12 dual enrollment opportunities, Virginia and U.S. history dual enrollment, Virginia and United States government dual enrollment.
Right.
We see a lot of math dual enrollment. We also have world language dual enrollment. So a student could really amass a beautiful amount of dual enrollment credits. And everything that we're offering, other than that medical terminology class, are going to be general education courses, which transfer, guaranteed transfer within Virginia public schools, but also transfer extremely well to colleges all across the country because they are gen ed courses that are required, for most bachelor's degrees.
When you
And that
say,
could shave some of her
Virginia
years
public
off.
schools, you're talking about institutes of higher education. So,
Correct.
right, so we're talking about public colleges.
There are
and universities.
15
Yeah.
of them here in Virginia.
Okay.
BMI gets a pass, but otherwise everyone is guaranteed to take those.
And then one other question. The dual enrollment, because I know in the past, I have an older daughter, you had to go to another school. You have to go to Germanna for the dual enrollment. Are they going to bus, or is that going to be offered at the center?
Yeah, so all the classes that you see up there, DE-wise, will be offered teacher permitting.
Okay.
Yeah.
Right here at the center.
Okay, so they don't have to go
They
to
will not
Germanna's
have to
campus
travel, yeah.
or travel.
Exactly, that's a
Okay.
great question. And it's a significantly discounted rate as well.
Okay.
I think community college is, one of the best deals going. You save, a third of the tuition. Further on that savings, we get a 70% tuition discount for our students taking dual enrollment classes here at the school. So it's a very affordable option for students to really get a head start on that post-secondary.
Because that's our responsibility for the dual
That
enrollment.
30%.
Yeah.
Okay, so,
In addition to that, I will say that we're working with Germanna right now and with University of Mary Washington, the hospital, Stafford Hospital and University of Mary Washington on providing opportunities for students in some of their labs. And so experiences, so there will be some on-site experiences as we develop the program out.
Absolutely.
That's one thing Barbara's doing is she's been working largely with our partners
Yeah.
now and Stephanie Johnson as well to start the conversations about those partnerships. Those are more likely to happen in the 11th and 12th grade years because there are some requirements, like age requirements and things like
Yeah.
that. So we'll talk more about that as we go forward.
Great question, though. Are there any other questions? Yes, in the back.
What about
I'm sorry.
existing students, like
I'm sorry. I
a
can hear.
10th grader that wants to jump into this? How are they going to get caught up on something they might not have taken their 9th or 10th grade year?
So,
I couldn't hear a question.
so you're talking about a current 10th grade student?
Right.
So current 10th grade students can apply to certain programs right now, not the center programs, but they are course pathways that start in the 11th grade and 12th. And so when you log into the system, it's not in this brochure. So when you log into the application system, you'll see the others that are available.
And
The
on
2-year
the
programs.
Your last screen, Dr. Davenport.
Yes.
The website that'll take you to, we also have a chart, a matrix on that secondary offerings and FAQs. There's a big matrix that shows you each pathway that's available for students in each grade. So that might help. We do have medical assisting still available for older students.
Yeah, nurse aid,
Yes.
medical assisting.
And then
Nurse
if they're
aid,
already in a pathway, let's say they
Culinary.
started the biomed program at North Stafford, they stay in that program. They don't have to transfer.
So, but like, what about next year's CNA group? Like, how's that going to work?
More than likely. So some of the centers, if space is available, we can try to let students in if there's, again, space available. But some of the pathways, because of the required prerequisite courses, if you will not have opportunities for older students to jump in later.
But would they be grandfathered in if they already took like intro to health and med?
There will be some
Mhm.
opportunities for students that have met the requirements of the first year course. Okay?
Yeah, if there's space available.
Those are
Yep.
outlined in our program of studies in detail.
But I think that's a good point. If you don't
It
get
does.
into the center, Intro to Health and Med is currently available at all of our high schools. So
Yes.
it's smart to go ahead and take that as an elective course in case, space becomes available in the sophomore year.
So like, are you guys actually treating this like a four-year program? Because then you'll have the two nurses teaching nurse aid 1 in the 11th grade, but then like, are you guys hiring 2 more nurse instructors to do the 12th grade for nurse aid 2? Or are the 2 instructors following those 20 kids through the 4 years?
I don't think we've probably worked out the staffing details
Not
fully
for a
yet.
couple of years out, right? That's on an annual basis. We
Mm.
really got the staffing details. But we've been able to offer that nurse aid program for many years and we'll continue. We're offering it to 11th grade and 11th through 12th graders this year as well.
Okay, good. We had a question right here. Yes.
I noticed the chart says center, like center English, center chemistry. What does that mean?
Okay, great question. Center English and Center History. What that means is students who are in those core classes will also have an opportunity to have thematic activities. For example, if they're in English, how can I incorporate and learn about health and medical science while I'm in English? So it could be an opportunity where they may have to write a paper on maybe comparing and contrast different medical tools. In history, what was the first surgical tool created or developed? So they'll have an opportunity to kind of actually cross-calibrate with those two content areas to make their activities more relatable. Yeah. Mm-hmm. Any other questions?
Does anyone
Okay,
have
so-
questions about the lottery system itself and how you apply, or do you want me to walk through that at all?
We get to, so they can apply for 4 of the pathways. Rising ninth graders could apply for 4 of the pathways. Which I don't want to complicate things, but I guess they would try to do their first one. Would you guys know that they're applying for multiple, so that you can also see? Like,
Yes.
so say I had her apply for 4 programs at once, but she only gets picked for one of them, but it's really not what she wanted. That's okay. But will you guys know that these students might be applying for multiple programs?
That's his
Yes,
question.
but
You're
it's
going to
a-
get a lot of kids
But
applying.
it's an automated system.
Okay,
So if you say that you were offered 3 opportunities, you applied for 4, you got offered 3, you accept 1,
okay,
the other 2 get offered to the next
Next
person in the
person.
waiting list.
okay.
And it's an automatic, it doesn't require us to send another email, it's just an automatic chain of events that happens.
Okay, okay. And the lottery system's based off of just
Well,
whatever it is?
Like I was saying out there, we're trying to ensure that there's representation from each zone high school.
Okay,
And then there will be additional slots that are just for the overall pool of applicants. So some of these programs are capped at 20 in the medical, but we may be able to offer 2 sections of 20, so that might be 40.
Yeah.
And like I said out there, demand will drive it. And if we can find the right teachers and make sure that, because they're not only teaching the rising 9th grade students, they're also teaching the 10th, 11th, and 12th grade students. And so they have multiple levels of students, and they can all teach up to approximately 150 each is the requirement of the state.
and then if you don't apply for any program, then you just stay at your base home school?
Yep.
Yep.
And you
I
have plenty of
have 2.
opportunities there as
Yeah.
well.
Right, okay,
Yeah, so,
Yeah,
because
2
every high
years.
school offers a number of courses, like Intro to Health and Medical and some other courses.
Another 2-year.
There's some engineering, tech ed, engineering, as well as, I mean, there's a lot of opportunities at each of our high schools. So not everyone has to apply and get into a pathway.
okay.
What if you only apply to 1 and then you don't get it? But then you want to go back, but you can't.
Then you might be able to apply again in the next year to see if there's space available.
Yep.
More questions?
You got another
Sure.
question?
Will the buses be like a central location? Will they be actually coming to the bus stop that your children have already, that the school district provides? Or, you know, if you only have 20 rising ninth graders, one bus driver, is he rolling, you know?
No, so it will most likely, so we'll be picking up the home stops,
Okay.
just like normal. There may be differences for each student depending on where they're going and where they live, right? And those are some questions I can't answer in detail. Number one, because I don't envy the person who has to schedule transportation for 31,000 students. But we may be doing some shuttling as well. So for instance,
At North Stafford, but he would like go to the PhD for a program. I'm going to North Stafford, and I wanted to know, let's just say for example, like I'm supposed to go there, but I'm doing the program here. Does that mean I have to like?
you transfer, you become a Brook Point High School student if you get accepted into this program. So there is a little bit of an opportunity cost there when you have to change your zone school because you were thinking in your mind that you were going to be going to that high school. But I think you'll find that in life there's a number of choices that we sometimes have to make that are either calculated risks or just just opportunity costs. Yeah.
I'm assuming that the high schools in Stafford County also have like car rider lanes, so if we can transport our student back and forth.
Yeah, and if students are able to, drive themselves, like if they have access to a vehicle, they can certainly drive to the school that they're attending. And if you play sports or you participate in VHSL activities like debate or something else, you would do it through the school that you attend full time. So it's that's the way that would work. You establish eligibility in your freshman year wherever you are. Any others? Okay, so the next session is going to start in about 5 minutes, 5 or 7 minutes. So we're here to answer questions, and if you have more detailed questions or you just wonder a little bit more, feel free to talk to one of us. We're happy to do that. And then if you want to see the biomedical sciences presentation, that'll start up here in just a minute. Okay, thanks so much for being here.
Thank you.